All right. Hey, everybody. Happy Friday. Hope you all are doing well. I am Dr. Patel, here to talk about numbness and tingling in your hands. If this is the first time that you're joining us, then thank you. Welcome. Hope you all are well. I am a physical medicine and rehabilitation doctor specializing in sports medicine, interventional pain management, and a focus on regenerative medicine, or getting you to help your own body heal without cortisone drugs or surgery. And on my channel, you can see us talking about various different things. If you missed any of our videos, you can feel free to catch them on our Facebook page or on our YouTube channel or on our website, fxregencenter.com. If there's anything that you want me to speak about, then please DM, comment, or email us at info@fxregencenter.com. But today we're going to be talking about hand numbness and tingling and what are the different causes of it. If you enjoy this video, please like, subscribe, all that fun stuff. And without further ado, let's get started. So, hand numbness and tingling. It's interesting because I've seen a lot of patients and talked to a lot of friends and colleagues who have had some numbness and tingling in their hands, particularly over these last couple of years when we find ourselves on our computers more and more. Whether you're still telecommuting or doing Zoom meetings or doing paperwork or whatever it may be, we find ourselves on our computers more and more people are starting to develop things like numbness, tingling into their hands. On the other hand, as we go from a relatively sedentary workplace environment and then try to get the heck out of the house and do things for fun, we're finding ourselves getting involved with some repetitive injuries and getting numbness and tingling in that way as well. So what are the different things that can cause numbness and tingling in the hand? That's kind of what I'm going to go through today. But first, I'm going to draw myself a little person here. So this is our little human that we're going to have. There's the torso. There's one arm here. That's pretty cute. And he's a cartoon, so he's got funky looking arms and elbows, and we're going to look at hands are probably one of the things that are the most challenging to draw. But I'm going to go ahead and draw this guy hand, and that's what we're dealing with here. Not too shabby. All right. But in any case, when we have numbness or tingling in the hands, a lot of times people find that you're shaking off your hand, or you feel like there's pins and needles in your fingertips. Some people describe symptoms like not necessarily tingling, but difficulty with things like buttons or small fine motor movement activities, or dropping objects. Like if you have a mug in your hand, right? Dropping those objects ends up being something that people describe when we have numbness and tingling of the hands. Or it might be as simple as, our hands falling asleep, waking up with our hands falling asleep, and we've got to kind of shake it out, right? So that numbness or tingling can involve various different parts of the hand. And if we really try to pay attention to where that numbness and tingling is taking place, that's kind of weird looking. Where that numbness and tingling is actually taking place, it's usually in a particular distribution. This is the funkiest looking hand that I've drawn. But people can feel sometimes that it's the numbness tingling is involving all fingers. But there are some times that you can kind of differentiate that, you're feeling numbness tingling in specific patterns. So when we have a pattern of numbness and tingling that involves, the thumb, the index finger, and the middle finger, and sometimes a little bit into the ring finger here, this distribution that I'm just kind of describing here, that's the distribution of the median nerve. the median nerve is one of the nerves that goes down our arm and actually goes across the wrist. And that's the nerve that gets injured or irritated in carpal tunnel syndrome. I'm going to describe what that means in a little bit. Now, if we have numbness and tingling in a different distribution, like let's say that we have some numbness tingling that takes place in the pinkies and maybe a little bit into this finger and down through here, well, that distribution is actually the ulnar nerve. The ulnar nerve also goes across the wrist, but towards the pinky side of the wrist, and travels up the side of the forearm, the pinky side of the forearm, and actually goes into that little crease that we have in the inside of the elbow, traveling all the way up the inside of our arm. Now, this is not a nerve that gets injured or irritated in carpal tunnel syndrome, but it actually gets irritated in what's called cubital tunnel syndrome. So I'm going to demonstrate here where the ulnar nerve kind of travels from here, going across the elbow and up like this. And the cubital tunnel is this small area right here on the inside of the elbow between the two little bones that we feel there. Differentiating that with the carpal tunnel and the median nerve distribution, right? That's the median nerve distribution, and the median nerve travels through this region here, kind of goes up the arm like so. And the median nerve carpal tunnel is right here. So these tunnels are basically just spaces through which the nerves are traveling. Spaces through which the nerves are traveling. If you haven't heard any of my previous talks, nerves are the electrical wiring that go to various different areas of our body. The nerves start from the brain, go to the spinal cord, and then the nerves exit out of the neck, go down through the armpit region, and then down the arm in different distributions. And the yellow median and the orange ulnar nerve are two of those nerves that travel down from the upper arm. And they travel through various different structures. They go through in between muscles, they go past bones, and in areas like the cubital tunnel and the carpal tunnel, they actually go under these little soft tissue ligament type structures that surround these tunnels that they travel through. Now, in the carpal tunnel here at the wrist, this is a tunnel that's created by what's called the transverse carpal ligament across the roof of the tunnel. The base of the tunnel is made up of the bones, the carpal bones of the wrist. And then through the tunnel travels the median nerve, as well as the tendons that are in charge of your fingers moving. And with repetitive activity using our hands, we can gradually cause irritation to that nerve that's traveling across there. And we used to think it was things like just typing, but it's actually not typing as much as it's other repetitive activities that could take place. But one of the things that I've seen with some patients is an increase in carpal tunnel type symptoms with even things like repetitive phone use. And I would argue that it's, putting yourself into various different positions on a regular basis that's probably causing irritation to that nerve. Now, the cubital tunnel across the elbow, that cubital tunnel, that ulnar nerve, is actually a very superficial nerve. You can feel it in that little space between the two bones on the inside of your elbow. If you rub your fingers across there, you could feel like a little rope that's there. That's actually the ulnar nerve. And the two most common ways the ulnar nerve gets irritated is if we're repetitively putting our elbows down on tables. So that repetition of putting pressure onto the nerve can cause irritation. And then the other thing that can cause irritation to the ulnar nerve is if we're hyperflexing our elbow too regularly. That happens in situations like if you're a side sleeper and you tuck your hand underneath your head when you're sleeping. This happened to me. I used to tuck my hand underneath my head and really flex this elbow, really causing this nerve to get stretched across this area here, and I started recognizing that my hands were falling asleep. So what did I do? I turned to the other side and started sleeping in this position, and then my left hand started falling asleep, right? I changed the body position, the way that I was sleeping, and now I have no more symptoms. But this is the type of scenario that if you put yourself into this repetitive environment of kind of constantly doing something like that or constantly putting your elbows down, that the nerve gets irritated across that tunnel at the elbow. And this tunnel, similar to the carpal tunnel here, this tunnel called the cubital tunnel, it's made up by a soft tissue that covers the roof of the tunnel. The base of the tunnel is the bones of the elbow itself. And through the tunnel comes that nerve, but also in some situations, we could actually have muscle coming into that area, and specifically the triceps muscles. This occurs for people that are more, weightlifters and things along those lines, people that have high level of activity using those triceps. Those muscles can actually get bigger and actually invade into the space of where that cubital tunnel is and cause pressure onto the nerve. Similarly, we could actually have invasion of some of the muscles of our wrist and fingers, even invade the carpal tunnel over here. And again, this is seen more when people are using their hands substantially, for gripping activities, manual workers, construction workers, people that are constantly using their hand for grip can have some increased muscle size going into those areas as well. Genetics obviously plays a factor. Some people are more predisposed to these type of things than others. But basically, irritation to the nerve across the cubital tunnel here, the ulnar nerve across the cubital tunnel can cause numbness and tingling into the pinky and the ring finger, more so the pinky. Irritation to the median nerve across the carpal tunnel at the wrist can cause numbness, tingling into the first three digits, the thumb, the index finger, and the middle finger, and a little bit into the ring finger. Now we can get irritation to the ulnar nerve across the wrist as well. This is in an area called Guyon's Canal, and this is basically another tunnel that commonly gets injured, particularly with things like falls. A fall onto the wrist can cause an injury at that level. Or repetitive use of something like a bicycle. Putting pressure onto the handlebars in an awkward fashion can actually cause irritation to that Guyon's Canal and ulnar nerve. That can also cause irritation to the carpal tunnel as well. So those are two very common things: irritation to the ulnar nerve at cubital tunnel, irritation to the median nerve at the carpal tunnel, that can cause numbness or tingling into the hand. But there's other nerves and other areas that things could get irritated, causing hand and numbness, tingling as well. So the median nerve and the ulnar nerve are kind of those distributions that we talked about there, but it's really towards the palm side. If we talk about the back of the hand, a lot of that innervation comes from the radial nerve. The radial nerve is the other big nerve of the top three nerves of the upper arm, and that's the guy that can get irritated and cause numbness, tingling on the back of the wrist. Depending on where it gets irritated, it can also cause things like weakness or a wrist drop, where it's challenging to actually lift the wrist up. And this nerve can get irritated in certain areas across the forearm, including right here at the meat of your forearm over here, as well as areas in the upper arm. An area in the upper arm that could get the radial nerve irritated with a trauma could be if we have a fracture or a break in the upper arm humerus at what's called the spiral groove. That's kind of the groove in the mid shaft of the humerus where the radial nerve kind of swings around the bone and travels down the arm. When there's a fracture in that region, the radial nerve can get substantially injured there, causing a wrist drop. Other areas where nerves can get irritated, causing numbness, tingling into the hand, include in the shoulder region at what's called the brachial plexus. The brachial plexus is kind of the web of different nerves that travel through this region, and an irritation to some of those nerves can certainly cause numbness, tingling in the hand. And finally, irritation to the nerves of the neck can cause numbness, tingling into the hand as well. Now, the distribution of numbness, tingling into from the nerves in the neck is actually a little bit of a different distribution. So if we think about, if we think about the neck again, I'm gonna have to do another drawing here, and we have different levels of nerve: C5, C6, C7, C8. That then travel down in different distributions and go down the arms, right? Good enough. So these nerves travel down the arms. Got to complete his body here. And when these nerves get irritated, they actually cause distributions in various different ways. So numbness and tingling in the hand, though, typically involves C6, C7, C8, and sometimes the T1 nerves. The C6 distribution is typically to this region here. C7 is typically to the middle digit and surrounding. And C8 typically is to the pinky. So numbness and tingling could involve nerve irritation from the neck as well. So basically, when we have numbness and tingling in our hands, it's not something that we should necessarily ignore. When we have that numbness and tingling in our hands, we gotta take a step back. If you have that one time and it's not a big deal, it kind of goes away, and, whatever. It's not the thing that we have to concern ourselves about. But if we're getting numbness and tingling in our hand on a regular basis, or if it's progressively getting worse, or if it's starting to include some pain, or if we're starting to recognize that there's some weakness in our hands, we're starting to drop objects and things along those lines, then those are the circumstances where we really start to have to think and say, all right, you know what? Maybe we need to actually get this checked out. Even if the numbness tingling lasts for a few seconds, you shake it off and it goes away, but you're getting that on a regular basis, it really is important for you to get that checked out and make sure we're not dealing with anything major. This is something that can be nipped in the bud if we catch it early enough. We don't want to wait until things are so bad that we're talking about nerve damage. Even if there's nerve damage, there are things that we can do to try to treat that, but certainly identifying what the issue is early on would be in an ideal scenario. So are the symptoms coming from carpal tunnel syndrome, cubital tunnel syndrome, irritation to the radial nerve or the brachial plexus or the nerves in the neck, or a combination of the above? That's really, really important to figure out, because we can really manage things conservatively with simple things like exercises and bracing if we catch this stuff early enough. So that's really it. That's what I had to talk about today with numbness, tingling in the hand. If you have numbness, tingling in the hand, please contact us. Let us know what you're thinking. Comment if you have any experience with numbness, tingling in the hand, with the diagnosis that you have, the symptoms that you had, or the treatments that you've had that have worked and haven't worked. And speaking of comments, Peter says, "Hi, Dr. Patel." Hey, Peter, thanks so much for joining us. And thank you all for watching, whether you're watching live or you're watching, in a recorded video on our website or wherever. Thanks so much for joining us. If you like this video, please share it. Please please subscribe. And if you have other topics that you want me to discuss, then by all means, let us know. Hope you guys have a great weekend, and see you next time.